Hi friends, welcome to Interactive Medicine. In this video, we talk about the femur. It is the proximal of the hind limb in tetrapod vertebrates. Of course, the femur is the only bone located within the human thigh. It is both the longest and strongest bone in the human body, extending from hip to knee. All of the body's weight is supported by the femur during many activities such as running, jumping, walking and standing. In this video, I used the left femur. Next, we can study the femoral head. It is a bony knob at the top of the femur or the thigh bone. This ball-like part of the femur articulates or connects with a cup-like indent in the pelvis known as acetabulum, forming the hip joint. The fovea in femoral head is located slightly posterior and inferior to the center of the articular surface of femoral head. Fovea capitis lacks any hyaline cartilage. It contains vascular canals in 2 by 3 of individuals. The fovea allows for the attachment of the ligament of the head of the femur. Here we can see the anterior portion of the shaft of the femur, and here is the posterior portion of the femur. The neck of femur is a flattened pyramidal process of bone connecting the femoral head with the femoral shaft and forming with the femoral shaft a wide angle opening medial vein. Femoral neck is potentially weak because of its relatively smaller cross-sectional area and spongy bone tissue or the cancellous tissue. Greater trochanter of the femur is a large, irregular quadrilateral eminence. It is directed lateral and medially and slightly posterior. It is overhanging the root of neck. It gives attachment to the gluteus medius and minimus, piriformis, obturator internus and externus, and gemelli muscles. The structure is indicated is the lesser trochanter of the femur. The lesser trochanter is a small protuberance of bone that projects from the posterior aspect of the femur. Infero-medially at the base of femoral neck, it receives the insertion of iliopsoas muscle. Trochanteric fossa is a depression at the root of the neck of femur beneath the curved tip of great trochanter. It gives attachment to the tendon of the obturator externus. Here we can see the intertrochanteric crest. It is a bony ridge located on the posterior side of the head of the femur, stretching obliquely downward and medial from the summit of the great trochanter to the lesser trochanter. The quadrate tubercle is a small tubercle found upon the upper part of femur that serve as a point of insertion of the quadratus femoris along with intertrochanteric crest and linea quadrata. The calcar also refers to the dense vertically oriented bone present in the posterior medial region of the femoral shaft superior to the lesser trochanter of the femur. Here is the anterior view of the femur. Here is the lesser trochanter of femur we can see, and the greater trochanter here it locates. We can clearly see. In anterior portion we can see the intertrochanteric line is a bony line that shows on the anterior demarcation of the union of the neck and shafts of the femur. It runs obliquely medially from the anterior surface of the greater trochanter to a position just anterior to the lesser trochanter. Here we can see the vascular foramina or retinacular foramina distributed around the femoral head and neck junction. Like as the name indicates, its function is the distribution of entrance of the vessels through the nutrient vascular foramina at the head and neck junction. The body or shaft of the femur, almost cylindrical in form, is a little broader above than in the center. The broadest and somewhat flattened from before backward below. It is slightly arched so as to be convex in front and concave behind. On the posterior surface of the femur, the intermediate ridge or pectineal line is continued to the base of the lesser trochanter and gives attachment to the pectineus muscle. Here we can see the pectineal line. Laterally we can see Gluteal tuberosity is surface on the femur in the leg that serves as the attachment point for the gluteus maximus muscle. Next, we can study the medial and lateral lip of linea aspera. The vastus medialis originates from the medial lip of linea aspera, while the vastus lateralis attaches from the lateral lip of the linea aspera. Next, we can study the tail. The nutrient foramen is an opening into the bone shafts which gives passage of the blood vessel to the medullary cavity of the bone. Here we can see the linea aspera means rough line is a prominent longitudinal ridge or crest on the middle third of the bone, presenting a medial and lateral lip as we already said, and also a narrow rough intermediate line. It is an important insertion point for the adductors and lateral and medial intermuscular septa that divides the thigh into three compartments. Below the linea aspera is prolonged into two ridges, enclosing between them a triangular area known as the popliteal surface. The popliteal artery lies upon the popliteal surface, which is covered with fat and forms the posterior floor of the popliteal fossa. The medial supracondylar ridge or line is the medial ridge of the popliteal surface continuing the medial lip of linea aspera. The next one is lateral supracondylar line or ridge is a prominent rough margin occurs above the lateral condyle of the femur. The medial lip of linea aspera ends below at the summit of the medial condyle in a tubercle. It is known as the adductor tubercle, which affords insertion to the tendon of the vertical fibers of adductor magnus. The bony protrusion located on the medial side of the bone's distal end is known as medial epicondyle. We can see here the medial epicondyle of femur. Here we can see the lateral epicondyle of the femur is smaller and less prominent than medial epicondyle, gives attachment to the fibular collateral ligament of the knee joint. The medial and lateral condyles of femur is one of the two large rounded masses of the distal end of the femur. Both are separated from it posteriorly and inferiorly by the intercondylar fossa, which is a deep notch or groove that is located at the bottom rear of the femur. The fossa is limited posteriorly by the intercondylar line, which separates it from the popliteal surface of the femur, and anteriorly by the distal border of the patellar surface. We can see here the patellar surface. The front part of the lower end of femur is named the patellar surface and articulates with the patella. It presents with a median groove which extends downward to intercondylar fossa and two convexities. We think this video is helpful for you. If you like this video, please make a thumbs up, share to your friends, and don't forget to subscribe our channel. Thank you friends. Bye. Have a nice day.